Back here in our area now, parents are working to get their little ones vaccinated following the CDC's approval of the Pfizer vaccine for kids ages 5 to 11. News 12's Noelle Lilly has more on the city's efforts to stop the spread and what doctors are saying to families that are hesitant to get their kids vaccinated.
There really is no reason to wait.
This week, the Centers for Disease Control and Prevention unanimously endorsed the Pfizer vaccine for kids between the ages of 5 to 11, making millions of children eligible for a shot that doctors say will save lives. Today, families in the Bronx are starting to roll up their little ones' sleeves.
We want our children and our families safe. We want them back in school. We want these holidays to be much different from last year.
Pediatrician Judith Flores says that although data has shown kids don't get as sick from COVID as adults do, the risk is still high.
And people may think that their children are not at risk, but it's also important to know that the CDC, when they did the review, took into account that children 5 to 11 are at the same risk as adults.
In fact, city data reported that New York City kids between the ages of 5 to 11 have been getting infected at a higher rate than any other age group, with those numbers peaking around the time school started. So far, only the Pfizer vaccine has been approved for those under the age of 18, and kids in this new age group will receive a lower dose.
I think it's a wonderful thing because it helps the kids and the community safe as well as the family. I mean, they're in school and they're around other children.
For families who might be a little more hesitant, Dr. Flores says their concerns are valid.
Parents in general want to do the best thing for their children, and they need the support and they need the information. So listening to people's concerns, helping them get to where they need to go so they feel comfortable in vaccinating their children and protecting them is very, very important.
Starting Monday, the city will begin hosting one-day vaccine clinics during school hours at schools that enroll children ages 5 to 11. A parent or guardian must be present or give verbal or written consent for a child to receive the shot. In Mott Haven, Noelle Lilly, News 12.